Hi, I'm Dr. Lexie Wang. I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today we're going to be talking about chins. Chins are an often neglected part of the face. Usually they are only noticed when they are too big or too small. However, I think even the chins that are too small tend to get under-noticed, and patients will notice other things on their face when actually the chin is the main issue. So I wanted to go over that a little bit today because I've done a bunch of chins recently and I think it's a helpful guidance for you all. The chin, right here, especially on the profile view, should be lined up with the rest of your face so that way you have a natural progression or angle from the nose to the chin, as well as this top area, which is called the radix, to the chin. So you wanna have a nice diagonal here, and then a very easy way of figuring out if your chin is in alignment is if this area, the radix, sticks out just as far as the chin. I don't know if mine is, but maybe you can hopefully see that you want these areas to be roughly in the same vertical plane. I'm gonna show you a couple of examples of what happens when the chin is not perfectly lined up. The first thing that happens is that it actually makes your nose look a little bit bigger because now the nose that's sticking out from your face is so much further than the rest of your face, including your chin. So oftentimes a lot of patients come to me because they feel their nose is too big, and really the issue is that their chin is just not big enough. So as you can see over here, this is my lovely patient coordinator. You guys might recognize her. And I threw up a simulation of what it looks like with and without a chin. If we just look at this picture over here, you can see that she doesn't look deformed. She doesn't look unusual. It's just something might not be totally right here. And her nose does kind of feature a little bit more prominently. However, if you look at this picture over here, this is her with a chin. You see how this is now lined up with this, the chin lining up with the radix here of the nose. Now the nose doesn't look quite so big in comparison to the rest of the face, like it's not sticking out quite as much. And everything else just looks a little bit better. The other advantage of adding a chin down here is that it also helps tighten the neck skin right around here. So this is similar to how if you have a pair of pants and you might not have a lot of shape or curve or definition like me, you know, they kind of just drape on you. But if you start going to the gym and you build up that booty, suddenly you're gonna have a lot of definition in those same pair of pants. And that's kind of what we're trying to simulate here, is that when you add a little volume to the chin, now the skin can also drape a little bit tighter. And everyone likes that tight jawline, so this is a very popular way of doing that. I have a picture now of a real patient we did this to, and he did also have his nose done, but I want you to see how this is where he was to begin with. And the first thing that I actually saw was that his chin was very recessed or smaller, and it makes it seem as if his nose is just sticking out too much. So we put a chin implant in him, and you can see how now it's lined up with the radix and how his nose just doesn't quite feature as prominently anymore. The other benefit you can see too is what it did to his neck. So we did not do any kind of neck work, no lipo, nothing, no neck lift. And you can see even just from here to here, it already looks a little bit tighter, even though all we did was put a chin in him. Again, this is Dr. Wang at West End Plastic Surgery in Washington, D.C., and I look forward to talking to you guys next time.